So what this quick presentation is about is to now looking at this. Now, if anyone in here has had or knows somebody who's had breast cancer, can I just see you raise their hands? Anybody? Okay, good. This is the smallest amount. In my first two presentations, about 95% of the room knew somebody that had it or has it. And what this is really about, and what was kind of cool in my first two presentations, I had like 4 guys in each one. And I went to one of them after the presentation. I said, well, you know, can I ask you? We know 400 men die a year of this disease. He goes, I'm here for my mom, my sister, my aunt. I thought that was great. Because even though this disease doesn't affect you, it still allows you to be in control and empowered with this information. Okay, so let's begin. As you know, my presentations, stop me. There's no formal format here. If you have questions, please just stop. Let's talk awareness. As we know, the science behind how, is this light? Let me see if I can turn this off. Is that okay? I'm able to shake. All right. As we know, I don't want to get too much into the science of how the cancer begins. I mean, we understand that there's different ways that cells multiply, and some cells become cancer, some cells don't. Well, this is just a short little paragraph in getting you to understand where some are benign, some are malignant, and what to do, and why those just form that way. I think it's important, and I think once you get this information, you'll read more of it, and you'll be able to study it, and look at various forms of this as a knowledge base, but this is just a tip. This is just a tip. What I want to talk about mostly is what are the symptoms of breast cancer. Because there's a lot of symptoms, okay? And as we get into this, there's going to be a little bit of graphic detail, so I hope this doesn't make anybody uncomfortable. But I think it's important just to be raw and honest. The symptoms of breast cancer include lump or thickening in or near the breast or the underarm that persists through the menstrual cycle. Now, why is that important? I looked this up a long time ago about the whole philosophy of the menstrual cycle. And trust me, I don't understand that personally. But what we know now is that because of estrogen levels, it's even more important to do self-exams around your menstrual cycle. Because we know that that's when estrogen levels are at their peak, and it's important to look at it from that perspective because you have a tendency to see more of that type of symptom. A mass or lump which may feel as small as a pea, but hard as a bullet. A change in the size, shape, or contour of the breast. A blood-stained or clear fluid discharge from the nipple. I'm at all of these so far, just so you know. A change in the feel of appearance of the skin or on the breast or nipple. Redness of the skin on the breast or nipple. A change in the shape or position of the nipple. An area that is distinctively different from any other area on the breast. A marble-like hardened area under the skin. My mom calls it a bulge, so that's why I called it that. Those are the traditional symptoms. Now, what I want you to remember is that just because you don't fall in this category and you have something unusual doesn't mean you're okay. You still should go in. These are things just what we know could be suspicious. Okay.